Welcome to this week's Keratoconus blog. I'm Dr. John Gelles, and this week we're going to discuss goals of specialty contact lenses for keratoconus. When fitting specialty contact lenses, we're looking to achieve three main goals, and that's to maintain corneal and ocular health, restore functional vision, and achieve optimum comfort. We can refer to these goals as the Triad of success. When I present these three goals to patients, they tend to think of a classic trilemma, where you have three options but can only pick two, so you must compromise on one. Specialty contact lenses for keratoconus is not a trilemma. You must have all three. We need to have good health, good vision, and good comfort. And getting to that point where we have satisfied all three of those goals is as simple as finding the right modality for that individual. For some individuals, they're going to do well with a corneal GP. Other individuals are going to use a hybrid. Others are going to be successful in a piggyback, and others in a scleral. So we need to find what's going to work the best for that individual. And even then, we need to come up with creative solutions to be able to achieve all three. When we look at restoring functional vision, we first need to assess that individual's patient's visual needs. Do you need to have clarity while driving your car at nighttime? Do you spend 8 or 10 hours a day on the computer reading text at a near distance? Or are you an athlete who needs performance vision? When we look at restoring functional vision, we sometimes need to find creative solutions to meet those individual needs. Sometimes that means that we have to use specialty customized optics on these specialty lenses, such as aspherics or multifocals or torics or higher order aberration correction. Sometimes we need to set up a patient in a monovision, where one eye is corrected for distance and the other for near. In other cases, we need to use a combination of medical devices, utilizing a specialty contact lens with a pair of glasses over the top, or sometimes a specialty contact lens with a cosmetic or prosthetic lens underneath. When we look at achieving optimum comfort, what that's really a function of is finding the correct modality for that individual. We need to find the right contact lens that you can wear comfortably for your visual needs. For some individuals, they're going to need to wear a lens 18 hours a day. Other individuals are only going to need it for the 3 hours that they're cycling on a Sunday. So we need to find the right modality for that individual to achieve the comfort that we need so that they can wear the lens comfortably for the time that they need. Now, it really comes down to making an appropriate fitting relationship between the specialty contact lens and the eye. When we have the appropriate fitting relationship, it makes for a comfortable and healthy lens wear. However, poor fitting relationships lead to complications. We can get abrasions or infections, which will cause pain, irritation, light sensitivity, redness, tearing. And these abrasions and infections can have long-lasting consequences. What we don't want is we don't want too much pressure on the apex of your keratoconic cornea, like what we see in the red circle. That lens is applying too much force to the apex of the cornea, and it results with an abrasion like what you see in that yellow circle. And if that continues over time, it can have long-lasting consequences in the form of a corneal scar, like what we see in that blue circle. So it's extremely important to make sure that our fitting relationship is correct. One of the most important goals is maintaining long-term health. Comfort does not necessarily equal good health. There are quiet complications, such as neovascularization of the cornea, which we can see off to the right, and those complications can cause problems down the line. Regular follow-up helps us identify these problems early, and we can make changes to the specialty contact lenses or even change the modality completely so that complications can be avoided. So to review, the goals of specialty contact lens fitting are to achieve the triad of success and to keep your eyes healthy, comfortable, and seeing well for many years to come. Thank you so much for joining us. Join us next week for another edition of our Keratoconus blog.